Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is bleeding control?
In recent years, what we've been witness to is very devastating mass casualty events where there's been an unfortunate, tragic loss of life. And what we've noticed in studying these incidents is that people can actually affect survival on site by being prepared and trained to identify what we call life-threatening bleeding, and then to apply techniques that were developed and have been tried and true to prevent the continual bleeding that occurs, and therefore can help the people and save lives.
What is in a bleed control kit?
One of the things that we have is hemostatic gauze that's in these kits that can help by stopping bleeding to continue. One of the things with research that we have seen and has also been deployed overseas is what's known as the combat application tourniquet. This CAT tourniquet, as we call it, is something that has been used extensively and has been shown to be beneficial. Normal tourniquets that people have used in the past have had some facet of buckles and clasp and rods that seem to work, but really these have become very, very straightforward so that the deployment of these things is very, very easy, straightforward, and helps first responders identify things and get people squared away quickly. I would take this tourniquet and I would put this strap through the clasp here, and I would bring it around. And I would tie it as tight as I could, first down like that. If it hurts, good. This is a windlass rod, and this is a windlass clasp. So, this is attached. At this point, the fine movement is to tighten this down and then put this windlass rod into the windlass clasp. At that point, we take the remainder of the strap and put it on the inside of the clasp, like so, and then we fold over this and then put the time on with our marking pen so that medical personnel will understand and know how long this has been in place. It restricts blood flow to the extremity, completely cuts it off if applied correctly. At that point, there is no reason why that person should bleed out from a wound beyond that tourniquet. We have what's known as quick Clot, which was actually developed here at the University of Massachusetts, and it basically is impregnated with things that will help the bleeding to clot faster. We have a yellow tourniquet, or excuse me, an orange tourniquet that just identifies it more easily that it's on as opposed to the black ones, but both colors are applicable, and also compression bandages that help with holding pressure on the bleeding area.
Who can use a bleed control kit?
Anybody. And this is designed specifically for anybody. I actually have this in my car, fair enough, I'm a surgeon, but this is actually for anybody, and these can be purchased on the Stop the Bleed website. But again, this is very straightforward, and our intention with providing this education to folks is to really show people that unfortunately these incidents are becoming more and more frequent. And it doesn't have to be those incidents alone. It could be the workplace, it could be at home, it could be on the road when you're driving and you witness something, or God forbid that you're involved with something. But the idea here is that everything is very easy to use and designed for folks at all levels, even grade school children. There is a course that we teach here at the University of Massachusetts, which is called BCON, or Bleeding Control. But we have an initiative now that is going statewide, but principally here in Worcester, we work with the Worcester Fire Department, we work with the Worcester Public Schools, nursing associations, a lot of folks here in the city.
How has the military helped with developing a kit like this?
A lot of things that we have gathered for use in our population comes from incidents where it's been pressing and emergent in need and necessity. That comes from the military. So these have been deployed overseas and in theater. And given the experience from combat medics in these applications for these devices, from the hemostatic gauze, the Clot or Clot here, to this tourniquet, they have found of great benefit in using them because they're, again, easy to use and they save lives. So gathering that knowledge and experience that they have has been able to be translated to us in the civilian population. And we realize that, unlike people have been taught years ago, you're not going to lose a limb by applying a tourniquet. When in doubt, with a life-threatening bleed, put it on, because then you can go ahead and again exact that change of trying to save a life.